Hello friends, today we are going to discuss a very important topic that the people who are suffering from diabetes, especially those who have recently been diagnosed with diabetes and are started on medication, is whether to continue or whether they need to take the medicine for life or what. I am your friend Dr. Sajid Bakal, Senior Chief Consultant and Endocrinologist. So this is a very important question that patients ask, as I said earlier, especially those who have recently been diagnosed with diabetes and have been placed on some kind of diabetic pill. They often come with this question whether to continue. They need to take this medicine for lifelong or they can stop it at some point of time. Because taking medicine for lifetime is most of the people often consider it some kind of cumbersome activity. Although it is not so, first and foremost, let us discuss what actually diabetes is. Diabetes, as we all know, means that the blood sugar level in our body is not maintained within the normal range. So, for example, if a person has a fasting blood sugar level of more than 110 or a postprandial, so meaning after eating food, if we repeat his blood sugar, say after 2 hours, if it is more than 120, or an average blood sugar that test that is called as HbA1c, if it is more than 6.5, that person is diagnosed as diabetic, and he or she, they definitely need medicine. Now it is up to the treating physician and endocrinologist to decide what kind of medicine to start, whether to start immediately go for the medicine or he can give some time to the person, to the patient, for some changes so that he can bring in some changes in his life that we call lifestyle modifications, to see if there is a chance that things can be controlled without medicine. But then there are, as I said, it is up to the doctor because he considers a number of parameters before he decides on whether to go for medication or lifestyle modification only. If the blood sugar levels are very high and HbA1c level is say more than 7 or 7.5, in those cases, the treating doctor will definitely will start with the person on the medicine. If the HbA1c level is say less than 6 point around 6.5 and fasting level or postprandial blood sugar level is not that elevated, this is a condition called as pre-diabetes. That is, this type person is about to enter a zone of where he becomes a full-fledged diabetic. Such person actually are the ones where we can give a trial, where we can ask the patient for lifestyle modifications, where we can ask the patient to change his food habits, to change his lifestyle. For example, if he is having a residential lifestyle, we will definitely ask him to go for a walk, a daily brisk walk for say 30 minutes in a day, or 150 minutes minimum of 150 minutes in a week. It has to be brisk walk, not that they are strolling around easily. That is not going to help. It has to be brisk walk, as in some studies they say up to 4 kilometers per hour. And then definitely he is going to change his food. He is going to reduce the consumption of the carbohydrates. He is going to reduce the consumption of the processed food. He is going to reduce the consumption of certain types of fruits and vegetables. And then this patient is being closely monitored for the next 2 3 months to see the effect of the lifestyle modification in these patients. If the person is able to maintain his RBC, his blood sugar level below a certain uh, maintain his blood sugar level below a certain value, then we can continue with the lifestyle modification, and we can definitely here in this case delay the introduction of the uh, diabetic drugs. But in case the doctor feels that the person is not up to the job, or rather the blood sugar levels have gone up from the previous one, and the person is not able to follow the program for strictly, then definitely he has no other choice but to start the medicine. So it comes down to this, that a person who is diagnosed with diabetes, who has pre-diabetes, who has blood sugar levels are still very low. They are not normal, but they are not very high. In those patients, we can go for lifestyle modification. We may observe them for a period, say for 3 months, to see if there is any change, to see if they are able to maintain that level. Then definitely we can wait. But if they are not, then we have to start the medicine. And once the medicine, diabetic medicine is started, there's a very good chance, say 90-96% chance that the person has to continue to live with the medication. Because in my experience of over say 10 years, I have rarely seen any patient who has started on medication after some time has been taken off the medicines and maintains his blood sugar levels. It's very difficult. Then it all also depends on the type of diabetes, because broadly speaking we have got two types of diabetes: type 1 diabetes, in which the pancreas are damaged. It is an autoimmune disorder and no insulin is synthesized in the body. In such persons, there is no option but to give the medicine, and definitely in this case, the insulin has to be taken for life. In type 2 diabetes, most of the time the people are obese, most of the time the people have got very bad eating habits, most of the time. And these are the people where we can try lifestyle modification methods and decide on whether to give the medicine or not. We cannot wait for long. Now the question arises whether we should give more time to the people to decide on whether they should be taking medicine or not, or we should wait for a certain periodization for 3 months and then start the medication. We have to understand one thing: that diabetes is a very very dangerous disease. It is not as simple as temperature say, oh, okay, blood sugar level is elevated, what else? No, it's not like that. Diabetes actually, it is like a slow poison. It slowly erodes and destroys our organs within. It slowly destroys our heart, it slowly destroys our eyes, it slowly destroys our kidneys and nerves and vessels in the brain. And with the passage of time, if you are not able, with the passage of time, these organs get damaged to such an extent that a person is not able to live a normal life. And once these complications set in, at the moment, as of now, we don't have any treatment for such people to revert those damages. So it is better to stop, to control blood sugar levels, and never reach the position where these complications actually start happening in your body, because as I said, there is no treatment available for people who have got complications of diabetes. I have seen people suffering from diabetic foot, they need to go for amputation of hand. Then some people have got certain neuropathies, they are always complaining of tingling, burning sensation in their feet. You provide them with number of medications, but nothing exactly helps them to the mark. And they suffer for what? For because they have not taken the problem seriously in the initial stage, when they needed to consider these things. Because diabetes is a condition where most of the people will have no symptoms in the initial few years, and it has been seen that people will have up to 5 years, up to 6 years, even if the sugars are elevated, even if the sugars are very high, people only after say some time that the big issue that the secondary complication starts, and once they start, there's no going back from that. So it's a the people with diabetes, they need to understand that diabetes control is not just to control the blood sugar. It is actually to save our body from the very very disastrous side effects of the disease. In type 2 diabetes, yes, people have, there are reports like people who have lost weight, a lot of weight, who are on strict gym and maintain a very strict diet. They can actually uh, bring the disease into remission. Once in remission, we can actually stop of thinking, think of stopping the medicine, and we can give a trial period of say for certain days or certain weeks and check continuously the blood sugar levels, and if we feel that the person is able to maintain the normal levels, so we can actually remove the medicine. And the criteria that doctors often use, that if a person is able to maintain his blood sugar level over a period of 6 months within the normal range, in these patients we can slowly try to remove the medicine one by one or reduce the dose in steps to see the effect, and whether these persons can be maintained without medication or not. In the meantime, I would like to say, if a doctor has suggested you that you have to take medicine, you should follow him, because I have seen many people, whom doctors or physicians have told them to take the medicine, they didn't take them, they didn't take it seriously, and later on they have nothing but to repent on, but to just, there is nothing left for them actually. So if a doctor has prescribed medicine, start taking the medicine as prescribed by the doctor, follow all the orders religiously, and if you have any problem, if you have any complications, if you have any adverse effects with the drugs, consult your doctor. Don't do anything on your side, and definitely don't follow the reels on the YouTube that tells you all the nonsense stuff that actually doesn't have any bearing in the real world. I think I have made myself clear here that diabetic medicine, the need to take the diabetic medicine, and in which cases we can stop the medicine. Hopefully, this uh, talk, you might find it some usefulness. Thanks for watching. Thank you very much.